Ryan Buccafurni of Integrity Rehab. They got a couple locations in Northfield, Ocean City, and he's been getting plenty of calls about this over the last week or so. Good morning, Ryan.
How you doing, Sully?
What's up, man? So I wanted to talk cupping. So tell our audience what exactly it is and what has been causing these strange circular bruises on Michael Phelps that's become kind of an internet joke, I guess, with the Trump Tower climber. I don't know if you've seen that.
For sure. No, cupping is it's a form of myofascial decompression. So you're literally putting a cup over an area of dysfunctional tissue and removing the air, causing a negative pressure that's actually decompressing the tissue or bringing the myofascial components away from the underlying surfaces.
Now, what's the theory behind it? How does it help an athlete, and what is it used primarily for?
Mostly we treat people like with muscle spasms or tight tissue. And the idea, by creating that negative pressure, you're loosening up that underlying tissue, you're bringing fresh blood to the area, you're modulating pain. A lot of the bruising you see is really just the superficial capillaries. When you create that negative pressure, burst. So the longer the cup's in place, the more bruising you'll see.
Now, you were trying to explain this to me on Wednesday, and I guess that, in layman's term, basically what you're doing is you're kind of, and not to sound gross or anything, it's not that extreme, but you're kind of pulling the muscle away from the skeleton just slightly to kind of get it to loosen up and create more elasticity. Is that correct?
Absolutely right. And again, if you have trigger points or any tight tissue under there, it helps actually reset those fibers. So individuals right after a session will get immediate range of motion improvements and feel significantly better, at least have a pretty good pain reduction.
Now, tell us about how many calls you've gotten this week on the cupping. I know a lot of physical therapy guys throughout the area, their phones are blowing up. Everybody wants to know what it's all about. They're trying to set appointments. Are you surprised at this, or when you saw Michael Phelps, were you like, okay, we're going to start getting a lot of calls about this?
It's funny. That's last Sunday night. I was watching the Olympics with my father, and then my brother Mike calls, who actually coaches at Holy Spirit, and he was like, "Do you see the marks on Phelps?" I'm like, "Yeah, man." And he's like, "You got to put something up because we've been doing the technique for around a year now." And then as soon as just like you said, that Monday morning, calls started coming in, and I think this week I've done more cupping on patients than I have in the last 3 months. So it's definitely something that people are buying in. I used to have trouble, when I would explain the procedure and then explain that they're going to have these bruises for a week. People would look at me like I'm nuts. But now that Phelps is doing it, it definitely gave some credibility, and people don't mind the bruises as much.
Now, one question I asked you on Wednesday was, how do the female athletes feel about it, especially being summertime? I don't think they'd necessarily want to go to the beach and have a bunch of bruises on their back and their shoulders and all that stuff. Or do they not really care because they say, hey, I want to feel better. I want to get these muscle tensions out. Is it an issue with the female athletes?
Absolutely. I can tell you my clinic per se has a lot of diehard athletes and a lot of people that just don't care. So they're like, I don't care what you do to me, Ryan. Make me feel better. I'll deal with it. So that's pretty refreshing. But I've definitely had some, where they go and they want to go to the beach for a week because they're, they don't even know how to explain what's on their back or on their neck.
What's the biggest misconception about it? I guess it would be that it's a cure-all. Come in, get cupped, and leave. And you're explaining to me, hey, there's a lot more that goes into it than just applying the suction cups, taking them off, and see you later.
Right. No, I think that's any soft tissue technique you do has a transient effect. So we put some cups on your shoulder. Say it's tight. You can't lift your arm fully up. We release the tissue. We increase your elevation maybe by 10, 20 degrees, and you feel better. That's the beginning of it. Now we got to make sure you keep those muscles loose so you don't just go right back to where you were. So whether it's stretching, whether it's retraining some of your stabilizers or what have you, that's the component that makes the carryover huge, not just putting some cups on and thinking you're going to feel great for the rest of your,
Now, how long, say you have an athlete, say a baseball player. I know you had Hunter Rich of the Atlantic Shore baseball team, the Babe Ruth squad in there. He's been dealing with a tight back throughout the spring and summer. How many applications does it take? Is it something you can keep doing every week? What's the process in terms of how long people should be trying the cupping and all that kind of stuff?
Very individualized. Like, I'll use it basically as needed, just like foam rolling or massage stick or any other manual therapy technique. If they come in tight and they're getting the improvements with it, we'll continue to do it. We can do it as part of like a active warm up too, where we can actually cup them, reduce the tissue, and actually have them move their arm or move their back as the cups are on to really free them up. So it goes with the whole plan of care, depending on how they're presenting and how they're responding. We'll do it really as needed.
Now, what are patients' normal first reaction when, boom, the first suction cup goes on and they feel their skin tightening, they feel everything kind of getting sucked up into that suction cup? Are they surprised? Are they like, ooh, this is different than I thought it might be?
Yeah, for sure. I think that's one of the misconceptions, is people think it's really going to hurt. And I wouldn't say it hurts, but it surprises you at first because you get a little bit of a pinch as the skin and the fascia is kind of drawn up. As it stays, your body kind of gets used to that feeling and starts to, most people say they actually like how it feels, like they like the tightness that it creates initially. And then when you release the cups after they've been on for a while, you get this rush of blood. And you get this feeling of decompression where everything just kind of lets go, and then that's where people really notice the difference. Like, oh my God, I feel so much freer. Again, what they were probably doing with Phelps is doing it relatively close to his meets, where he could free up the tissue, feel good, and then go in and dominate like he always does.
We're talking with Ryan Buccafurni, who's a physical therapist at Integrity Rehab in Northfield and Ocean City. Buc, I know one technique you're high on, which I haven't tried yet, but I may be in there to give this a shot. Dry needling. It sounds painful. Tell us about this technique and what's the theory behind it?
Well, Sully, I'm pretty sure next Olympics you're going to be seeing the craze is going to be dry needling versus the cupping. You know, each 4 years something else comes up, but the needling it's a more invasive way to get at the same problem. So if you have tight trigger points, chronically tight muscle spasms, you can actually go in with the needle, can cause a twitch response and get those muscles to let go. So it's more invasive, but more effective as far as I'm concerned. And with dry needling, these are people you can hit them with 1, 2, 3 sessions and get rid of spasms that they've been having for 6 months to 2 years. A very powerful technique.
Wow. I would assume it's a good technique for baseball players, particularly pitchers. You get a lot of tightness in the shoulder, in the lats, all that kind of stuff. Is it something you see more common in certain types of athletes?
For sure. Any overhead athlete, you notice a ton of tightness in their teres major and their lats and the back of their shoulder, just nodules that form, or trigger points that are, again, just from the demand of going overhead so repetitively and so forcefully. So as far as dry needling those patients, it's really changed my outcomes and been a game changer as far as treatment goes. And pitchers love it. The feeling they get after, the freedom they feel in their shoulder after the sessions are pretty awesome.
Now, if there are parents out there listening who have sons or daughters that are maybe high school age, Glory Days does a lot with the high school sports. At what age can you start doing this stuff? Is there any age that's kind of too young to really use these techniques?
The answer is really no, but there's needle phobia. Obviously, as individuals get older, they're more willing to try it. I just did a 14-year-old Friday who had shin splints with her mother's, explained the procedure to her mother. She was willing. She's a competitor. She was like, I just need to run Monday. I need to feel better. So we needled through her shins, through her calves, and she was left the session pain-free, could squat without pain. So, you get the buy-in that quick when you can make those quick
Really?
changes.
That's interesting, because shin splints can really be a problem that lingers for a long time and has an adverse effect on a lot of runners. So it's that quickly of a response?
Sometimes, not every time, but in her case for sure. Runners, we treated a lot of runners in my clinic, and they tend to again develop overuse issues because they run so much. So between shin splints or glute tendonitis or piriformis syndrome, all those things associated with tight muscles dry needling is a very powerful technique.
Now, Book, I got to believe the CrossFit athletes are all about this kind of stuff, right?
Absolutely. They're the other ones. Go overhead a lot, do a lot of crazy stuff, good stuff, but definitely get jammed up at times. And again, and then also want to continue to work out. So it's a technique that allows people to continue to work out, not much shutdown time. So yeah, I have a ton of CrossFit athletes that come in and get treatment, and they swear by it. They love it.
So that's really the advantage, I guess, to the cupping, to the dry needling, is these athletes don't have a lot of downtime where they're on the shelf, for a week or so because of a sore shoulder or a shin splints or something like that.
For sure, you're getting them back feeling better quicker, without a doubt, and that's what kind of drew me into dry needling and cupping and some of the newer techniques. Is I want to get my athletes better, quicker, faster. They want to be back on the field. They want to play. It's what they love, and nothing I hate more than telling somebody they can't play, or that kills me, being an ex-athlete at one time.
Good stuff, Book. We got to let you go. We're up against the clock. But before we do, if there are some people out there listening who want to give this a shot, who maybe have some soreness, some tightness, they want to find out more information, how can they get in touch with you?
Integrity PT, it's 609-241-6339. We're over at the Tilton Shopping Center next to the Spot, and we'll love to talk to you.
Good stuff, Book. Appreciate you taking a few minutes to explain some of that stuff to us, and enjoy the rest of your weekend, bud. Thanks.
Thanks, Sully. You too, man.
All right, that was Ryan Buccafurni of Integrity Rehab.